Hi again. So here's your voiceover PowerPoint for response to intervention. What is it? So response to intervention I'm going to be talking about in this presentation, and then you are going to have an RTI project to do that we will go over together in class. But this is the informational part where you learn what it is so that you can proceed to do your project. RTI is a school-based multi-tiered system. It is done in schools, in public schools, in general education settings in order to help children that are struggling with either behavioral or academic issues. There are 3 tiers in RTI, and we're going to talk about each of those tiers in depth here. And basically the goal is to keep kids in general education and to slowly put supports in place to see how much support a child might need to remain in general education. So the people that can initiate RTI are the OT, the teacher, the special ed teacher. Any of those people can start an RTI intervention. It is from Gen Ed, although many Gen Education teachers don't know about it or they're not well trained in it. Almost all of your special ed teachers are going to know what RTI is and how to implement it. One of the things that I want you to understand is that RTI is an educational term. It is not our term. It's a teacher educational term. We need to know about it if we're going to be working in schools, but because we need to be able to speak the same language as the teachers that we're going to be working with. And when we are working with school age, as an occupational therapy practitioner, the teachers are, and as well as the children and the parents, but the teachers are our very, very important team members. We need to be in the classroom and we need to be consulting with the teacher on a regular basis. Otherwise, none of our interventions are going to really go very far. So, Tier 1 from a behavioral perspective is for all students in the district or in a school and at all settings. You can implement an RTI level 1 in any setting in the school. Now, the intention of an RTI level 1 intervention is to prevent any concerns or issues and to be proactive. So let's think about an example. So say we have a bunch of kindergarten students, and what we know about 4, 5, and 6-year-olds, so kindergarten age children, is that they are learning about writing, paper pencil skills, right? Most of them have some exposure to writing, but they don't write a lot yet or write all that well yet or legibly, and they certainly might not know how to form words or form things from left to right or on a line or any of that stuff. So we know their paper pencil skills are emerging at this age, and it's something they're all working on. One of the other things we know about kids this age is behaviorally, it may be the first time that they're being expected to follow directions and follow classroom rules and have classroom expectations. So some of these kids may have been to preschool, but some may not. Some have been home. So we know there's a mix of behavioral places where these students are. So we want to prevent behavior problems, and we want to be proactive and make sure all the children understand how to behave in a classroom. And Tier 1s need to benefit all children. So a common example for an RTI level 1 in a kindergarten classroom would be hands up, close your mouth. Hands up, zip your lips, or whatever they call it. So when the teacher puts their hand up in the air, as soon as the student sees it, they're supposed to put their hand up in the air and close their mouth and make a little line across their lips, right? And so what that does is that gets everyone on the same behavioral page. It gets everybody to pay attention. It benefits all the children. They learn about rules. They learn about listening when the teacher is talking. They learn about how to follow directions with other children around them. So that's an example of a behavioral level 1, Tier 1 intervention in a kindergarten classroom. Tier 2 intervention, also from a behavioral perspective, is going to be students that are at risk, and you're going to take a look at the level 1 or Tier 1 interventions that you already did and look at the students that still aren't quite where you would like them to be. So maybe there are still 3 kids in the classroom that when everybody puts their hand up and puts their finger across their lips and listens and looks up front, 3 children don't get it and they're still doing whatever it is they're doing. So we're going to say, okay, so we put into place the tier 1 intervention, and these 3 students, they're just not getting that. They need some more intervention. So tier 1 allows us to rapidly respond to concerns in the environment. It allows the teachers, without having to go through a referral process or anything else, to be taking data along the way, see what's going on, say, ooh, I better do something different for those 3 kids. They're not getting it. So you are going to initiate some intervention strategies just for this small group of students that does not need to benefit everybody, just for them. So following on our example, those 3 children don't get it about being quiet and keeping their eyes up front when the teacher raises her hand. Maybe the teacher is going to sit those 3 children in the front of the room and gather them in the front of the room right before she does her quiet sign, so that she can give them an extra cue. So maybe she finds Susie, Sally, and Bobby, and she says, come on up here for a minute, guys. And she pulls them to the front of the room, and she goes, okay, I'm going to do it now. And then she does her hand up in the air and her finger across the mouth, and then they're there, they are attending, they're seeing it, and they get it. So maybe that works. Then she can take data saying those 3 students, at least at the beginning of the year, need to be brought up front in order to get this and what it means. Then we have a tier 3 behavioral intervention. Now, that worked for 2 of the students. We're just going on our same scenario here. The hands up in the air and the finger across the lips, all the students get it. The 3 students are cued ahead of time. They come up front, and the teacher looks them in the eye and does the sign, and everybody gets it except 1 student is still not getting it. She brings Susie up front with the other 2 students, and she does her sign with her hand up in the air and her finger across her lips. And Susie is just talking and yakking and falling on the floor and running around and doesn't get it. So we're going to have to do a very targeted intervention for her, and we're going to have to get her assessed at this point. So at this point, the teacher says, okay, I don't have any other guns in my little satchel here, nothing else that I really have to get her to attend and behave like the other students when it comes to getting their attention. I think I'm going to ask for a referral to a specialist. So what we get from that is we get some more durable procedures. It's very intense. It's just for 1 child. They're pulled out and they're tested to see what the issues might be. And then interventions are created just for that student. So let's do the same thing, and we'll use the same example, but the academic part of that example. I talked to you earlier about the academic example, which was that they're having trouble with paper pencil skills. They don't really quite know what to do with them. So we know most kindergartners are just working on this right now. So we know that it's a good thing to work on it for everybody. No one's going to be harmed by it. And if some children already know how to use paper and pencil, they'll just get more practice. So we're going to initiate that each child, when they come into the kindergarten class in the morning, they need to stop at the sign-in desk, they need to find their name on their little card, and they need to trace over it. With the special, we put a tracing paper, they put it on top, and they trace over their name. If they want to, they can also just write their name. So they have a choice, trace your name or write your name. So it is preventative. It helps be sure that all children are exposed to paper pencil tasks and to their name. It is proactive. We want to make sure that we get ahead of kids who might not have been exposed. Maybe some children come from socioeconomically low environments, and so they don't have exposure to paper, pencil, and all that stuff. Maybe a child comes from an orphanage in a different country and doesn't know how to use writing utensils, never had that opportunity. So we're going to be proactive, and we're going to prevent issues, and all the kindergartners in the district, in every school in the district, are going to have this sign-in procedure, right? Doesn't harm anybody and potentially could help a lot of students. Let's go to our tier 1 for this academic intervention. Now we have, everybody comes in and they sign in except for these 2 students. One student comes in and the teacher cues him, sign in now, and the child picks up his name and throws it on the floor and stomps on it and walks away and doesn't know what to do with it. And then the other child comes in and he picks it and he looks at all the cards in there and he can't find his name. He just really does not know what his name looks like. And so every day the teacher has to cue him which one is his name, and he can't pick up the pencil. He doesn't know how to hold it. He holds it in his fist and just jabs at it. So he's having a very hard time understanding what to do with paper and pencil. So the teacher decides, let's do something just for those two kids. So I'm going to keep their names aside. So when they come in, I'm going to say, remember, your name's over here, not where the other ones are, so that they can start to recognize their name. And she thinks that the one child that's throwing it on the floor and stomping on it is because he doesn't know what to do with it. So she goes hand over hand and she helps them trace over their name. And the child who's stomping and throwing things stops stomping because now he gets it. He had some receptive language issues and didn't quite understand. But when she shows him hand over hand what to do with the card and she keeps it separate so that he can find it, he does okay and he starts to respond. So that was a good strategy, and it was pretty quick and immediate, and it's working. However, the other child, he still just can't even figure it out. She puts his name aside with the other child's name, and even when it's the only name there, he can't find it. He doesn't know what it is. He doesn't know what it's for. He doesn't know what writing utensils are for. And she's very concerned about him not understanding this whole process, and she's not sure why. So she is going to refer him for assessments. They are going to come up with some one-to-one interventions to help this child. He may be referred for special education, for occupational therapy, maybe speech therapy if he's not understanding, for some auditory processing. We're not really sure, but we're going to throw the book at him and get anything evaluated that we possibly can and find out what's going on. And that's Tier 3. So one of the really wonderful things about RTI is that it's based on evidence and data collection. One of the ways that schools collect data for Tier 1 intervention is by doing universal screenings. They do, for example, kindergarten screenings. So they take all the kindergartners in the whole district and they bring them in and they ask them the same battery of questions and put them through the same battery of activities of color recognition and shape recognition and writing your name and an interview and the whole bit that they do at that. And they usually do an eye screen, a vision screening, and they do a few other things. They take them to the gym class, they make sure they can jump and hop and skip, and they do a whole screening. And they collect data on that. So they see what percentage of kids fail kindergarten screening, what do we do afterwards, right? So they follow this information so they kind of see what happens, what percentage of kids get referred on to what services, then what outcomes do they have. So data collection is very important for the district. It gives them a lot of information on what services they need to have in place because they're going to have a certain number of children that are going to need those. The teacher is going to collect data on academic and behavioral consequences of her in the classroom Tier 1 things. So she's going to say, okay, so with the people signing in on the way in, out of 15 students, 2 students had trouble. All the other students by the 4th week of school knew exactly what to do. And by the 7th week of school, probably most of them were writing their name independently and not tracing it anymore. Now they all knew, and then by the end of the school year, they all know how to write their name. Nobody has to trace it anymore at all. So she's collecting data on what's going on so that she knows that out of 15 students, this is typically what's going to happen. And she'll keep an eye out for those kiddos that may need some extra assistance. The teacher keeps that data on the Tier 1 interventions as she moves on to Tier 2. She's going to share that data with the OT and special education and anyone else on the team and say, you know, I've got these 2 kids and they're just not getting it with signing in the name. And I think I need some more higher level interventions for those students. So then she's going to take data on those 2 students in addition to the rest of the students, and she's going to mark down On Monday, I hand over hand assisted so-and-so to trace his name. And then by the end of the week, he understood how to trace it, and now he can trace it by himself. Next week, I'm going to work on having him copy, and I'll start with hand over hand and then reduce my help. So that's a tier 2 intervention, is with a small group of students. And she's going to collect the data and see how that child is doing with that intervention. And tier 3, we're going to take a look at what worked and what didn't in tier 1 and tier 2. We're going to find out in that small group with the behavioral and academic interventions what's working, what isn't, and which kids do we need to refer on for special services. And that data goes with the child that is referred on for special services so that the person who is evaluating the child can see what has been done and can have a direction to go in. So we're looking at tier 1 interventions that OT can do. An occupational therapy practitioner certainly can recommend tier 1 interventions for students in general education and in special education classes. It's going to be for the whole school or the whole classroom, depending on what the intervention is. We want to be sure as occupational therapy practitioners that we're staying within our scope of practice. We can look at these things. We can look at behavioral, sensory, motor, ADLs, things like that, things that are in our framework and our scope of practice. We are not going to put into place tier 1 interventions that are for the teacher to do, that are academic in nature. So sometimes that's a very fine line. But when it comes to teaching methods, we leave teaching methods to the teacher. We look at sensory, behavioral, ADL, things like that, maybe motor. So let's be clear. The example I gave earlier about the teacher having the children sign in when they come into class, that is an academic, teacher-based tier 1 intervention. That is not something an OT would put into place. That is something a teacher would put into place. It is educational in nature and about teaching. If we were going to do one of ours, it would be more sensory or behavioral or motor, something more in our scope of practice. Sometimes the occupational therapy practitioner will consult with a teacher when they're doing an educationally based RTI. Sometimes the teacher will say, I would just like you to check this out and tell me what you think. That's fine. And then the teacher is going to take data on the targeted behaviors, and the occupational therapy practitioner is going to adapt the environment as needed. So you're going to make suggestions for environmental adaptations, for activities, for all different things. I find the most that I do are adaptations in the classroom. I move where people are sitting. I change people from sitting on a chair to sitting on a ball. I might change the lighting in a classroom. I do a lot of those sort of tier 1 interventions. We want to also be sure that our tier 1 interventions are evidence-based. We certainly are taking data. The teacher actually is taking data and collecting evidence to see what's working and what isn't. But when we think about what tier 1 intervention or tier 2 intervention we want to try, we want to look to the evidence to give us an idea of where to get started. We're not going to just be grasping at straws and giving everyone weighted vests. So in conclusion, it is a systematic evidence-based approach to having children stay as much as possible in Gen Ed. We are going to assist with and provide RTI interventions with the teacher. We want to make sure we stay in our scope of practice and use data-driven information and evidence to drive what we're doing. And we will talk about the specific RTI project and the format of that when we get together in class.